Introduction to observation skill. Introduction to the module. Observation means monitoring constantly using sight, hearing, smell and touch combined with your knowledge to monitor any changes of humans' health or social well-being. In this module, you will be introduced to standard observation fields and the duties of common observation sectors. Topic to be covered: health observation, health carer, importance of health care observation, social work observation, social carer, careers in social work, social worker skills, importance of social worker, child observation, duties in childcare. Health observation. Healthcare observation is used by skilled clinicians, doctors, and therapists to glean information about their patients or clients. They are observations of behavior from the clients used to determine a diagnosis and treatment plan. Typically, notes are taken during the interaction with the clients or, in some cases, immediately after. Clinical observations are the basis of therapy and treatment, and the carers can learn about their client. In a care setting, observation is often separated into objective and subjective observation. Objective observation: it is visible and measurable signs that are usually factual. Objective observation is typically factual that you'd be ready to see and live. These can jointly embody observance of the input or output magnitude relation, blood in excrement, allergies and bruises. Subjective observation: it cannot be measured, and usually verbal communications from the older adult on how they feel, such as nausea, an upset stomach, sore muscles, and headaches. These signs should be reported to the registered nurse or doctor to be looked into further. Subjective observations are what you can't measure. Health carer. Health carer consists of health professionals, physicians, advanced follow registered nurses, alternative registered nurses, medical assistants, clinical pharmacists, and alternative aid professionals. Clinical care teams usually include physicians, nurses, physician assistants, clinical pharmacists, social workers, and other health professionals who help establish new collaboration, communication, and cooperation to serve their patients' needs better. Doctors. Doctors, or physicians, are vital members of the healthcare team. They have years of education and training. Nurses. Nurses work closely with patients, but their duties depend on their education, their area of specialty and their work setting. There are many types of nurses: licensed practical nurses, LPN, registered nurses, RNs, and nurse practitioners. Advanced practice registered nurses. Nurse anesthetists, nurse midwives, and nurse practitioners, also referred to as advanced practice registered nurses, APRNs, coordinate patient care and provide primary and specialty healthcare. Pharmacist or medicine assistants. Pharmacists are experts in the field of medication. They work with physicians or physician assistants to ensure new prescriptions do not interact with the patient's current medications. Importance of healthcare observation. A well-trained clinical carer ought to develop clues early and stop proof from obtaining worse. This can be the explanation for why the observation skills are most vital for this job. Practical observation skills will assist you in providing higher care to the patients and improve your prospects during this challenging, nonetheless rewarding field of labor. Observations should form part of the nurse core skill set and provide the best early information on a patient at risk of deterioration. Taking and recording observations should be seen as pieces in a clinical jigsaw to illustrate how patients are progressing and demonstrate areas of potential concern. Social work observation. Social work is a practice-based profession and an academic discipline that promotes social amendment, development, cohesion, and individuals' and communities' authorization. Welfare work observes the understanding of human development, behavior, and social, economic, and cultural establishments and interactions. Social employees area unit professionals aim to boost overall well-being and meet the essential and sophisticated wants of communities and other people. Social carer. Social employees work with many alternative populations and individuals, significantly specializing in those areas that are unit vulnerable, oppressed, and poor. Depending on work speciality, job title and place of employment, a welfare worker could also participate in legislative processes that always form social policies. Social employees are educated and trained to deal with social injustices and barriers to their clients' overall well-being. A number of these embody poorness, state, discrimination and lack of housing. They additionally support shoppers and communities. Social carers work with disabilities, habit issues, or expertise domestic conflicts. Careers in social work. A military social carer educates and works with military members and their families to assist them with the distinctive challenges in their line of labor. Community welfare worker. Community social employees set up for and administer new programs or allocate resources to the community. Mental health welfare worker. Psychopathy will give several challenges to folks and families across the country. Those living with mental state disorders usually want extra support and a focus that social employees will give. School welfare worker. A college welfare worker works directly with the college, teachers, parents, and workers to form positive students who will thrive within and out of the doors of the room setting. Social worker skills. Each social worker employs a diverse set of skills to do their work, but specific skills can be beneficial to those in the field. Below are some examples. Empathy. This skill enables the social worker to put themselves in their client's shoes. Having empathy can offer a social worker a deeper understanding of their client's problems. Organization. With other daily responsibilities, social workers need to be highly organized. The amount of paperwork and caseloads can add up from networking, calls, billing, and organizing services for everyone. Communication. Social workers should be clear, concise, and transparent with clients, families, care providers, and colleagues. Assertive communication can help to mitigate misunderstandings and break down other communication barriers. Problem solving. No case is the same, and a social worker often works hard to find the best solution in a difficult situation. A good problem solver can help clients obtain the best services and support needed. Patience. As a social worker, you will work with diverse clients. Maintaining patience and understanding clients from different racial and socio-economic backgrounds is a core component of social work practice. Importance of social worker. Social workers are the only ones doing the work that help vulnerable people. You can find social workers doing tasks such as helping people in hospitals cope with acute conditions and chronic illness, providing therapy in community health centers, keeping students from dropping out of school, assisting prisoners as they re-enter communities, providing rehabilitative support in drug and alcohol centers, working as first responders during natural disasters, providing outreach and long-term care in nursing homes and homeless shelters, working as clinical therapists for members of the military and veterans. Childcare observation. Childcare is a fundamental fact for several families. It provides opportunities for children's mental development and social engagement. Service will occur during settings and extended daycare, family daycare and in-home care, occasional care and outdoor college hours care. Child care workers assist with the needs of infants and young children in a range of settings such as child care centers, hospitals and educational centers. Duties in childcare. Childcare staff usually do the following: supervise and monitor the security of youngsters, prepare and organize mealtimes and snacks for youngsters, help kids keep sensible hygiene, change the diapers of infants and toddlers, organize activities or implement a syllabus that enables kids to find out about the globe and explore their interests. Develop schedules and routines to make sure that kids have enough physical activity, rest, and leisure. Watch for signs of emotional or organic process issues in kids and produce potential issues to the eye of fogies or guardians. Keep records of children's progress, routines, and interests. Child care staff scan and play with babies and toddlers to introduce basic ideas. For instance, They teach them a way to share and alternate by enjoying games with alternative kids. Child care employees facilitate preschool-age youngsters to steel themselves for preschool. Young youngsters learn from participating, questioning, and experimenting. Child care employees use play and alternative tutorial techniques to assist children's development. Child care employees may additionally watch faculty-age youngsters before and when school. They typically facilitate these youngsters with their school assignment and take them to after-school activities, like sports practices and club conferences. Summary. Healthcare observation is used by skilled clinicians, doctors, and therapists to glean information about their patients or clients. Observation skills are essential to establish a detailed and accurate treatment plan that provides the best care for the older adult. Social work is a practice-based profession and an academic discipline that promotes social amendment, development, cohesion, and individuals' and communities' authorization. Child care workers assist with the needs of infants and young children in a range of settings such as child care centers, hospitals and educational centers. Child care employees use play and alternative tutorial techniques to assist children's development.